ABS TV Channel 10, the GIS, and ABS Radio 90.5 FM. Proudly serving you, reaching more and more people every day.
Good evening and welcome to this very special edition of Focus on COVID-19. This as we join the rest of the world in observing World Health Day. Tonight we will take a keen focus on the Oxford AstraZeneca vaccine, the main vaccine currently being rolled out here at home. Well, helping us to explore all the details, the concerns and facts surrounding this vaccine is consultant nephrologist and internist at the Mount St. John Medical Center, Dr. George Mansoor. So happy you could join us tonight.
Thank you very much for inviting me, and happy World Health Day as it is here today.
Awesome. Thank you so much once again for being with us. Now, I'll start by asking you to, of course, share some more greetings with our audience on this occasion of World Health Day and talk to us about the importance and the significance of this observance.
Well, World Health Day is a celebration, remembrance of the World Health Organization. Occurs on April 7th every year, and it's meant to foster better health for all peoples of the world. Every year there is a theme or a logo, and this year it's meant to encourage fairer and healthier peoples all over the world. We all know that health is not equitably distributed across the globe. Now we are experiencing that now in terms of vaccine availability, but at a more a different level, different communities in different countries have different access to health care, quality of life. We need to start thinking about health as a human right, that all people's potential can only be unlocked for the better of humanity if they have a good health, both physically and mentally.
Great. And one thing that comes to mind, of course, when I think of this theme, is there's so much focus right now on the COVID-19 pandemic and all issues surrounding that. Sometimes I fear and I wonder if other matters of health are at risk of being neglected and put aside. Is that a major concern at this time?
It's a big concern. And the concern is that the major causes of morbidity and mortality, which is sickness and death in the Caribbean region and in other countries, are non-communicable diseases. And these non-communicable diseases have had to take a back seat, so to speak, in most of the countries due to the pandemic that is ongoing and has been occupying the time and effort of health care practitioners and hospitals and health services. So we really do want to remember that there are lots of persons out there in the community who suffer with non-communicable diseases, and while we are battling COVID, we need to ensure that they obtain their medications and the care they need,
yes,
so that the complications from non-communicable diseases don't increase further from their current high level. So yes, we need to take steps to ensure that persons with NCDs can access and get the care that they need.
Absolutely. Now, we'll come to the issue of vaccines just right now. But where are we currently in this fight against COVID-19? I know that many countries, in fact, almost all countries, are focusing on the rollout of the vaccine programs as the main thrust or pushback against this virus. Here in the OECS, in the Caribbean, and bringing it more closer to home in Antigua and Barbuda, where are we right now?
Well, we have to think of the COVID pandemic in a global sense. Mm-hmm. So it's no longer that any country is isolated from any other country. And therefore, we need to think of the global pandemic as our business. What's happening in another country is very much of concern to us. So we have seen a great increase in vaccinations across all continents. However, many countries and many continents are lagging behind. There have been spectacular successes. For example, the UK, after having a bit of a stumble, have gotten up and are running really the fastest 100 meters you've seen. They are vaccinating at an incredible rate and reaping the benefits simultaneously and seeing large reductions in hospitalizations and death. So this is really a global problem, and hence it brings to the fore the whole idea that the availability of vaccines has been somewhat limited for many countries because people are not thinking, politicians in big countries are not thinking that what happens in other countries could affect them. We are already, unfortunately, seeing evidence that that's the case because of the development of new strains of the virus in different countries. Now, if one looks at the entire globe, we are not yet seeing a reduction in the total number of cases worldwide. We are still seeing an increase in cases and in deaths. However, I think if we continue on the current trend, sometime later this year, perhaps in 3 or 4 months, we are going to see that the global numbers start actually going down. And that would be showing that the entire world now is actually coping with the virus and getting it under control. Obviously, there are countries that are having tremendous difficulties with COVID-19. Brazil is having a lot of difficulties, and there are other countries for various reasons. It's not just policy issues, availability of vaccines. It has to do also with the acceptance of the population of vaccine and so on. But I think at the end of the day, what happens everywhere is of concern to us because as a small region, we have certain vulnerabilities. But we also have some actually advantages. Having a small population, a relatively small population in the region means that we can actually probably get to our maximum immunization vaccination much quicker than some of the larger countries. And we're already seeing that evidence on the charts. You can see the Caribbean countries are doing extremely well in the percentage of the population that is vaccinated. So we are just part of the big problem. We are managing our own part of it. And so far, I would say that the vaccination strategy put forward here has been immensely successful because it's been rated as one of the top vaccination programs in the region.
Yes. Now, you paint a fairly optimistic picture of where we could be if we stay on course with our vaccine programs, not just here in Antigua, but across the world. But what about the worry of new variants? How big is a threat? How big of a threat is that to derailing these efforts?
Well, we have to think of these variants as needing a substrate to develop. In other words, if we can increase the vaccination rates all over the world, we can actually reduce the numbers of people who are sick. And the fewer patients that are sick, the less chance there is for these variants to develop into variants that we may not be able to cover with certain vaccines. So inherent in increasing the vaccination rates around the world is the idea that we would be able to control the variants. So far, of course, we've had a number of new variants that have come out. That's because the infection rate is still very high in many countries. To date, however, I think that we have started in the Caribbean and other countries to trace these variants. In other words, do sampling and analyze to see what the genetic code of the virus is, to see if there are alterations that could be of concern. And the scientists know which type of changes, when seen, could bode for some problems down the road.
Okay, excellent. Now, another issue that I'll come to is the issue of vaccine hesitancy and skepticism. As early as December last year, we know that many folks were concerned about the safety of vaccines, the safety ratings between different vaccines. How valid really are these concerns?
Well, as healthcare practitioners, we take safety, of course, very seriously. Vaccines have a long track record of safety and effectiveness. We all grew up getting our various vaccines. We had to have them to go to school, college. And so the current vaccine strategy is building on that experience and is helping build on the previous infrastructure that we have. Now, because of the special situation with the pandemic, the best vaccine to really take is the one you have. You can't take a vaccine you don't have, and the sooner you take it, the sooner you'll have some level of protection. The pandemic is not a static phenomenon. In other words, we're not just facing the same enemy over time. What's happening is the pandemic is dynamic. It's changing over time. And hence, we also need to be dynamic and agile in how we plan to cope with the pandemic in terms of many things, availability of health resources, availability of different vaccines, medications that might be effective, so that who knows what's sort of going to come down the road. We do know that we're doing our best at this time in terms of vaccinating people and reducing the number of people who will get sick and die. That's critical. But we still have to, I think, keep a little bit of an open mind in terms of what's going to come down the road, because it is a little bit of an unknown.
Yes. Now, how far are the scientists, the medical specialists and experts in terms of developing some treatments and some therapies for the COVID-19 disease?
Well, thank you for that question. I think there is a continuum of care that we have to look at with COVID-19. First was prevention.
Yes.
Prevention is critical. It's not a surprise to anyone that persons who suffer with the non-communicable diseases, whether it's hypertension, diabetes, being overweight, or cancer, these are the persons who suffer an excess complication rate with COVID-19. So anything one can do to keep those conditions under control, as well as trying to keep your immune system in good shape, will help you prevent you from getting COVID-19, or if you contract it, will assist your own body to sort of fight it off. Further along that continuum are various treatments that may be given depending on the severity of the illness. So you can have very mild illness. We have lots of people who acquire COVID and they just have minimal symptoms. They're home and they're fine. In 2-3 weeks, they are recovered. Sadly, we have people further along who get much sicker. They start having lung complications. Sometimes they may need oxygen or even a respirator. And we do a reasonably good job in treating those patients. We have some treatments that we can offer which are quite good. And that has helped us to keep the number of persons who have died in Antigua really down to a decent number. Of course, nobody would ever like to see any person die from COVID-19, but sometimes, despite your best efforts, there is unfortunately a loss of a patient.
Now, I'll come back to the AstraZeneca vaccine. Now, news broke today in the UK that one regulator is not as advised that folks under 30 should not be administered with the AstraZeneca vaccine. What does that mean for us here in Antigua and Barbuda?
Well, okay, I think we need to sort of zoom out and try to understand what is going on with the vaccine and what is being observed that has concerned some of the regulators in some of the countries. So, first of all, the positive benefits of the vaccine in European countries, especially England, the UK, have been phenomenal. The benefits are incredible. We've already seen a great reduction in severe COVID-19. Now, the surveillance systems of vaccine deployment monitor for side effects, monitor for rare things, and as part of that surveillance system in Europe and in other countries, they have found that they have seen patients who have had blood clots with COVID-19, with the vaccine. Now, one complication also is that COVID-19 itself can give you blood clots.
Interesting.
Yes. So now these cases have really been not that numerous, and they have been primarily, at least in Germany, occurring in younger people. So the regulators have been looking at this, trying to see if it is really a true signal. In other words, is it really something to do with the vaccine, or is it something else that appearing? Because of course you can take the vaccine and then you can go outside and something else could happen to you,
yes,
and it could appear that it's the vaccine. So the job of the scientists who do surveillance is to try to tease that out. So one of the rare things that they have found, which they are not 100% sure yet whether it is definitely linked to the vaccine, is a number of cases of persons who've had blood clots, but in the veins of the brain.
Okay.
So and it's been happening in younger women. We don't, again, there's no certainty yet. They have not found it in the American database. This has only been found at the moment in the German database, and to a much lesser extent in the British database. Now, to give you an idea how rare these are, they are experiencing one of these cases in every 300,000 to 500,000 people who have received the vaccine. So it's a very uncommon complication, and part of it is because it's so uncommon, it's challenging the scientists to really understand if it's a real connection or not. So what you're seeing a bit in Europe is they're saying, well, okay, let us think about how we should use this information. We're not 100% sure yet, but we may want to take some action. We have other vaccines that we can use, et cetera, et cetera. So let us make some slight changes to the way in which we're administering the vaccine. And that's really what's happened in the UK. There's been a bit of a sort of a caution placed on much younger persons who they may recommend perhaps them taking a different vaccine or waiting a while until the vaccine is administered. So it's a very uncommon type of adverse event, and it's very rare.
Yes.
So it's posing a real challenge for the scientists. And that you could see that in the press over the last few weeks, where they were just looking at very small numbers, and they still are, and they're trying to figure out, well, is this really a signal that something is really going on?
Has monitoring for these side effects also been done with the other vaccine brands?
Yes, the monitoring is occurring with the other. You also there have been cases of venous thrombosis with some of the other vaccines, but in a much, much smaller occurrence. Now, one of the problems you face, of course, is trying to figure out whether something causes something else in a complex world where a person is exposed to so many different things. So that's the position of the UK regulators, and the Germans have taken a similar position. So in our region, there's really been no advice at this point from anybody that can point us in any specific direction. Needless to say, we feel confident that the vaccine is safe. And if you think about the benefits of the vaccine in saving thousands of lives, it far sort of outweighs the small number of cases that are happening. Of course, we never want to have any major problems with any medication or vaccine or anything that we give, but of course, sometimes there's nothing you can do. You offer a treatment and may have an undue side effect and cause a problem for a person.
Okay. Have we seen any rare, significantly adverse side effects here in Antigua and Barbuda?
Well, persons here can call the COVID hotline and report if they're feeling unusual symptoms. We have not really seen any patients who've been very sick or who've had a major problem. Some people have reported side effects, symptoms that occur after vaccination, soreness, etc. And however, I'm not part of that group, but I'm certain we have not heard of any major problems with the vaccine. Certainly, if there are people out there who have experienced or are experiencing, they should report it to the COVID hotline, because we want to know.
Yes.
We are not we want to know what's happening out there in the population, because that is information that's very useful to us.
All right. Now, I've been following the news, and I know that moves have been made as far as conducting trials on young children in efforts to eventually get those young children vaccinated. What's the latest update in that regard?
Well, some of the vaccine manufacturers have completed studies in children. They seem to produce antibodies just like older people. These studies are usually small. They're not, many thousands and thousands of children. And they've really been very, very safe. They've not experienced any difficulties. I think, as time goes on, we'll understand better what's happening with perhaps these vaccines and what their safety profile would be. When we approve a vaccine, for example, one of the messenger RNA vaccines, we may have only studied 50,000 people, when in reality the vaccine may be given to millions and millions of people. So that's why that surveillance part is very important, in order to be able to detect something that may only occur 1 in a million or 2 million, because you need that level of surveillance in order to detect that kind of very rare thing. You're not going to find it when you do your studies to get registration or to get the vaccine approved.
Okay. Now, over a quarter of the population here in Antigua and Barbuda would have received their first dose of the Oxford AstraZeneca vaccine, and of course, looking ahead towards the second dose. Talk to us about how that two-dose system works, and what's the importance of the significance of a second dose, and will there be booster doses in the future or every year? What does that scenario look like?
Okay, well, the AstraZeneca vaccine is a two-dose vaccine, just like the Moderna and Pfizer. So in the case of the AstraZeneca vaccine, many countries are giving the second dose after a period of 8 to 12 weeks. In Antigua, we're doing that. We're giving it at 12 weeks. This has been found really to be the optimal time to give the booster dose. So persons who were vaccinated would have been given an appointment at a certain date 12 weeks after their initial vaccine to come for the second dose. They should keep that appointment, because that's very important for the durability of the protection. When we say that a vaccine that has 2 doses has such and such a benefit, it's assuming that you take the second dose and not just the first dose. So in order to get that protection, and to maintain it, you really have to take the second dose. Now, if you're late by a few days or a week or two or whatever, it's not going to make a big difference. Now, in terms of what's going to happen down the road, in terms of whether we'll need booster doses or additional doses of the vaccine, I think that's a bit of an unknown at this time. Remember, I said we are battling a dynamic pandemic, so we don't know yet, and that's why we have to keep thinking ahead in terms of what could happen and what we need to prepare for. So if, for example, things work out really, really good in terms of the durability of the vaccinations, you could see in a few months, 3, 4, 5 months, that there will be a great reduction worldwide and things will, sort of slowly get back to where things were. If, on the other hand, the durability is not there and no unusual strains come in, we may be able to just give booster doses of the vaccine to maintain the durability of the protection. So that will have to be worked out over time as we learn more about the durability of the protection that we get from the 2-dose regimen for the AstraZeneca vaccine.
Okay. Now, for many of us who would have received the initial dose of the AstraZeneca vaccine, and between that 12-week period where you would be issued with your second dose, what level of protection or immunity am I walking around with?
Okay, that's a good question. So first of all, you do start to make antibodies from the vaccine by about 3 weeks after you receive the first dose. However, you really don't get the full protection of the vaccine until after you take the second dose. Specifically with the AstraZeneca vaccine, you do get about 70% protection with the first dose, and then when you take the second dose, it goes up to about 83%. Now, you have to remember that if you only give one dose, the protection you're talking about is up to a certain period of time. These studies were not run over years and years. They were run over a short period of time. So it's very important to get that second dose. In other words, how it was done in the study, that's how we want to do it. Now, in the case of the AstraZeneca, what was found is that actually the slightly longer wait between the 2 doses to 12 weeks was much more effective in providing durable protection than doing it at 4 weeks or 6 weeks. That's why in the UK and many countries in the Caribbean, they are using the 12-week mark to deliver the second dose.
Absolutely. Now, for individuals who would have contracted the COVID virus, I understand that it's not recommended that they get the vaccine. Why is that so?
It's not recommended that they get the vaccine immediately after they recover because they would be considered probably to be immune because they have just contracted the infection themselves. It is, however, recommended that sometime after, perhaps 3 to 6 months later, that they do get vaccinated. Currently, we don't have a certain way of knowing how long the natural immunity persists. And hence, the recommendation is that they wait a period of time, probably around 3 to 6 months, to get the vaccine.
How prevalent are reinfections, of course, without the use of vaccination?
Reinfections have been described, but they are actually fairly uncommon in the shorter term period. So if one has had COVID-19, it would be kind of unusual to be reinfected in the first 3 to 6 months. But certainly past that, there have been many cases of reinfection. I would have to say it's a little bit less common. However, of course, all bets are off if the person had COVID-19 over a year ago and so on. We don't know yet if the protection is going to be going beyond that period of time from a natural infection.
Okay. Dr. Mansoor, I want to ask you this question. Why, well, to your best knowledge, why is it that some people do much better with COVID-19 than others?
Well, it is, there are many factors. We do know that older persons don't fare well with COVID-19. And when I say older persons, I'm saying people over the age of 80.
Okay.
If a person over the age of 80 acquires COVID-19, it's actually very bad news. It has significant comorbidity, and likelihood of death is very high. And that's why when the pandemic first started, you were hearing that so many people, older people in nursing homes and elderly people, were dying from the COVID-19. As you move down the age scale, you actually see less and less people getting serious illness, except for those who have what I described earlier, the non-communicable diseases. So if you're 40 years old, but you suffer with these diseases and they're not well treated, you can certainly experience a turbulent period of infection with COVID-19.
Absolutely. Now, stay with us here on Focus on COVID-19. Of course, this is a special edition on the occasion of World Health Day. We'll come back and speak a little bit more with Dr. Mansoor as we wrap our discussion on COVID-19 and, of course, vaccinations in Antigua and Barbuda.
Hello, this is Sir Richie Richardson, and I'm encouraging everyone to take the Oxford AstraZeneca COVID-19 vaccine when it's your turn. If you have any questions, reach out to a nurse, physician, or healthcare professional for answers and credible information. Vaccination will help protect us from this deadly virus so we can get back to our families, friends, loved ones, hobbies, and the activities that we all cherish and miss. Don't cause a scene. Take the vaccine.
This is a public service announcement from ABS Television.
My mask protects you. Your mask protects me. Mask up.
This is a public service announcement from ABS Television.
At school, we've taken steps to slow the spread of coronavirus, but we all must continue to take personal responsibilities to protect ourselves and our loved ones too. I make sure to wash my hands frequently, stay 6 feet from others when I'm out, and always wear a mask when in public. These small actions make a big difference. This is a public service announcement from this station and the ABS Kids Connect team.
My name is Aitan Henry from Henry's Herbs and Salad Vegetable. I'll be getting vaccinated, and I'm hoping everyone does, especially the farmers. We have an important job to do, feeding the nation. Each vaccinated, all protected.
This is a public service announcement from ABS Television.
Thanks for staying with us here on ABS Television for this special edition of Focus on COVID-19. And of course, today we are observing World Health Day, along with the rest of the world. And tonight, this special program focuses on COVID-19 and of course, vaccinations taking place right now here in Antigua and Barbuda. And of course, availability of vaccines has been a major issue, and we understand that as early as tomorrow, our country, Antigua and Barbuda, should be receiving an additional batch of COVID-19 vaccines as we look to get folks vaccinated here in Antigua and Barbuda. Now, Dr. Mansoor, as we speak about the rollout of vaccines here in Antigua and Barbuda, I think it's important for individuals to remember that the protocols should still be observed. Now, just because you've been vaccinated or you've had your first dose, as you said earlier, means that you have the level of complete level of immunity. No, you do not. And explain for us some of the reasons why we should still observe our protocols, particularly wearing of our face masks.
The protocols are very important for the time being. There may come a time in the future at some point where when the disease quiets down, we may be able to relax these, but Right now, based on the numbers of the population that have been vaccinated, we need to keep these protocols in place. So we need not only to keep wearing our masks, washing our hands, and keeping our distance,
Yes.
but we need to also, follow general good hygiene practices no matter where we go, home, supermarket, anywhere we go, practice proper etiquette. This actually goes a long way to reduce the possibility of transmission of infection between one person and another. It gets kind of, I think, tiring sometimes for people. We understand that. We all are in that situation. But I think we're kind of in that 800-meter race. We're kind of at the 400-meter mark. And we need to get that energy boost to finish the next 400. So we need to sort of reinvigorate ourselves. So we continue these practices all the way down until we have, enough protection in the community that we can relax them. At this point, we certainly can't do that, and we encourage everyone, including adults, children, even young children. I've been impressed with how they remind me sometimes of why you didn't wash your hands or why you didn't do that. So this is wonderful, but we do need to remember to keep these practices going, yes.
Now, for individuals in our population, and there are many individuals out there who are still hesitant towards taking the vaccine, what's your message to them?
Well, the vaccine has been deployed in millions and millions of people worldwide, particularly in Europe and developing countries. The vaccine is very safe. The vaccine is effective in reducing hospitalizations and deaths. It is yet not clear to me whether the reported links with the very rare cases of blood clots are real or not. That we will wait and hear what finally comes out of that and what advice may come later on this week or next week with regard to that. But the benefits of the vaccine, to me, continue to highly outweigh the risks of the vaccine. And hence, that's what we really care about, which is the benefit going to be much better than the risk? And it is. So I would encourage everyone to take the vaccine if you can get it, because that is really the only way at the moment that we can protect ourselves from acquiring COVID-19 as long as we continue to do the face masks and the washing and the distancing. Those are two things that sort of go together.
Okay, great. Dr. Mansoor, so happy to have you with us this evening. And just before you go, I'll give you another opportunity to again share your thoughts on the occasion of World Health Day being celebrated across the world today.
Well, World Health Day is really an important day. And as I said at the beginning, it's really meant to create equality in healthcare across all countries and societies, and allow each person to fulfill the human right of good health, physical and mental, to allow that person to be the most productive that they can be in their lifetime. So it's really a noble cause, and the WHO and countries around the world are looking at ways, concrete ways, in order to materialize that goal into reality.
All right. Dr. George Mansoor, thank you so much for your time tonight.
Thank you as well.
All right. And we've been speaking to Dr. George Mansoor, the consultant nephrologist and, of course, internist at the Mount St. John Medical Center. And you've been watching Focus on COVID-19, of course, a special focus on the vaccination efforts and the AstraZeneca vaccine currently being rolled out here in Antigua and Barbuda. Stay with us and enjoy what's left of tonight's programming. Good night.
You are in tune with the nation's stations, ABS TV Channel 10, the GIS, and ABS Radio 90.5 FM, proudly serving you, reaching more and more people every day.